This presentation is about the mouth mirror inspection for the registered dental assistant in California. The definition of the mouth mirror inspection is an inspection of the oral cavity to include the charting of obvious lesions, existing restorations, and missing teeth. It also involves an inspection of the soft tissues, commonly known as an oral cancer screening. In California, the scope of practice is for the registered dental assistant, the RDA, the RDA-EF, the RDH, the RDH-AP, and of course the DDS. This mouth mirror inspection should not be confused with an oral examination and diagnosis, which is only performed by a dentist. The indications for a mouth mirror inspection. All new patients, it is recommended by the American Dental Association that all new patients have a mouth mirror inspection. As well, all patients should have a mouth mirror inspection, including a soft tissue inspection, annually. The mouth mirror inspection is also contributes to the assessment of the physical and mental condition of the patient. It's often said that the oral cavity is the gateway to the body. Sometimes we see oral manifestations of certain systemic diseases that may show up first in the oral cavity. So it can be an assessment of the physical condition. And as far as the mental condition, there are some times when people do not take care of their personal hygiene. They may be depressed, they may have other conditions, they may have eating disorders that we see changes in the oral cavity. The mouth mirror inspection assists the dentist and gives the patients access to care. What this means is that in California, the RDA can be performing the mouth mirror inspection, and this frees the dentist to actually treat another patient. And so RDAs, you do contribute to access to care in California. Components of the inspection. So we need to have some patient records for charting, for making notes. There's an extraoral component and an intraoral component. Looking at patient records, a medical dental history is important. And again, remember, RDAs, we're not examining and diagnosing, but if we see a condition in the oral cavity, it could be because a patient is taking some medication or has a systemic disease. The radiographs, again, we are not diagnosing, but we can see if clinically we see no presence of third molars, we can actually observe on radiographs whether a person has third molars or whether missing teeth in the oral cavity are actually present in the bone. We will be noting on the patient's clinical chart any of the findings so that we can present this to the dentist. We may end up taking photographs of our patient or use an intraoral camera. And then the study casts, these are just here really for FYI. Normally after the mouth mirror inspection and the doctor's examination and treatment plan, the dentist may request study casts, but these are considered patient records. Charting. Charting, we need to know as RDAs information so that we're accurate in this procedure. You need to know your tooth anatomy. We need to be able to recognize normal soft tissue structure, the color of a normal soft tissue, the texture of the tissue. We need to remember our tooth numbering system. Most of us use the universal numbering system. We need to know color coding, if that's used in the office, either for manual patient records or computerized patient records, and what the symbols and abbreviations are. Here's an example of a color-coded record. The red usually represents diagnosing, so that would be something that the doctor is actually calling out for us to note in the oral cavity diagram. Blue or black can be existing restorations. This is a record that came to me more than 20 years ago. It was from a dental clinic, and you can see where there's a diagram that if you find any abnormalities in soft tissue, then you could actually draw it on this diagram. And it has a really nice comprehensive list of all of the areas that should be inspected. The armamentarium for a mouth mirror inspection would be the basic setup, predominantly, or primarily I should say, the mouth mirror. The Explorer and the periodontal probe are not to be used by an RDA for probing any tooth structure or soft tissue. It's simply here as part of the photograph of a basic setup. 2x2 gauze we will be using mostly for inspection of the tongue, and a lot of textbooks will include a tongue depressor, although in dentistry we normally use a mouth mirror to retract or depress any tissue. And a light is very important. It's important to have good lighting when performing the mouth mirror inspection. So let's look at the procedure. So extraoral, we're going to have a visual inspection, and it actually starts when you bring the patient back to the treatment room. We want to observe the patient's gait. Are they able to walk on their own? Are they using a walker or a cane? Do they have any paralysis, which may actually prevent them from taking care of their mouth? Are they have any arthritis or inflammation? Could again affect the oral cavity. Piercings or tattoos. While tattoos don't affect the oral cavity, it is part of the patient record. And we know that tongue piercings, lip piercings can affect the gingiva. We want to take a look at our patient and look at facial symmetry, any facial birthmarks, and note that on the chart. We also want to keep in mind that we need to be accurate because dental charts are frequently used to identify bodies, to identify humans, for different violent situations. And so we want to make sure that we are keeping accurate records. Also, the vital signs could be taken for a patient as part of the patient record. Extraoral, we will palpate or palpation of the TMJ for any pain or popping or clicking. Again, we're not diagnosing, we're just noting it. The cervical lymph nodes, we would also be palpating the lymph nodes and noting any discomfort by the patient or any nodules that we might feel. We would palpate the lips and note any, also visually, noting any discoloration or hard nodules or ulcerations. I'd like to say at this time that you see the operator is not wearing gloves. These are very old slides from the college I teach, or where I teach, from probably the 1960s. And I just use them as a tribute to days gone by. But please wear your PPE. The procedure continues intraoral to look at the labial mucosas and the frenums, right buccal mucosa, left buccal mucosa for discolorations or ulcerations. Also continuing the palate and the oropharynx to look at the tonsils and the uvula. Retromolar areas you need to use indirect vision with your mouth mirror, and we're also going to look at the gingiva just as discolorations, any lesions, ulcerations. Continuing with the tongue, you could have the patient stick their tongue out, check for fissures, color, and also palpate the tongue, have them lift the tongue to look at the ventral area going back. This, of course, is the dorsum, and checking to see again for discolorations, the lateral border of the tongue to the right. Here's where we would use a 2x2 to actually gently pull on the tongue or manipulate the tongue for us to see those lateral borders of the tongue. Salivary glands are palpated with hands in opposition so that you're compressing the tissue, checking the sublingual glands and the submandibular salivary glands. We also want to palpate the parotid gland for any nodules or discomfort by the patient. And we're actually also going to look at the hard tissue, the teeth, for fractures, obvious carious lesions, or any other condition that would be of concern to the patient. If you're an RDA and you're performing this procedure on your own, you want to make sure that if you're writing or even using a computer, that you're using some kind of barrier and overglove and your PPE. Some terminology that may be used for clinical notes. Symptoms, remember, are subjective, where the patient is telling you what they've experienced, and objective is what the person performing the mouth mirror inspection actually observes. This is a little acronym SOAP that you might find some dentists using: subjective findings, objective findings, assessment, which is the diagnosis, and the treatment plan. Findings, some offices use WNL, within normal limits, or other comments. That should be an R here, other comments. I recently attended a continuing ed course for the Dental Practice Act in California, and the attorney suggested to actually make comments rather than WNL, which was, in her opinion, we never looked. Little dental sarcasm there. And then noting any patient education that you might have conversed with the patient. Terminology, you want to use some verbs: that the area was inspected or observed or palpation of or evaluation of. Patient reports, patient exhibits, patient presents, the patient's chief complaint is, or the patient indicates. An example of a clinical note or progress note, or the old-fashioned term chart entry, is the date, the name of the procedure, any specific findings, patient's remarks or questions, what the doctor diagnosed, what the doctor's remarks or treatment plan recommendations for the patient. And then, as the RDA performing the mouth mirror inspection, you want to write your initials and your assigned number or the complete signature. So a recap is that this was the mouth mirror information on the mouth mirror inspection, which is a duty of the Registered Dental Assistant, RDA, in California. It is indicated to gather information for the dentist. It is not an exam and diagnosis. That is for the dentist only. And as an RDA, we need to know our oral anatomy and to be able to identify normal versus abnormal. You want to note the findings in the chart and any conversation, dialogue history that you have with the patient. This is the end of the mouth mirror inspection slide presentation. Thank you very much. It's almost baseball season. Go Padres!